You know, throughout the course of everyday life, many of us are going to sustain injuries. Hi, I'm Captain Joe Bruni, and what I want to discuss and talk about is how to treat a punctured lung. A punctured lung can be a closed injury or an open injury. A closed injury, such as blunt force trauma to the chest or rib cage area, that can break or fracture a rib, puncturing a lung. Or an open wound, such as a puncture from a knife or other foreign object that goes through the chest wall into the lung itself, puncturing it. Either way, the patient is going to require medical treatment from the emergency room or a local physician. If it is an open wound that has punctured through the chest wall and into the lung, a first aid kit can be used to help treat that dressed area. Vaseline gauze can be placed over that wound and taped down on 3 sides to eliminate the person getting air into the chest cavity between the chest wall and the lung, causing what's known as a pneumothorax. This will cause a collapsed lung and a great deal of pain. By taping down the Vaseline gauze or some other type of dressing that can be placed over the wound and taped to allow air to escape. Also, some of the signs and symptoms that a puncture to the chest cavity may have indeed affected the lung is bubbling or some type of bubbling coming through the blood that is emitting from that puncture wound. This is a sign that the lung has been punctured, and you want to prevent air from getting into the chest cavity. If it's a closed type of blunt force trauma, the person may also experience a pneumothorax or a hemothorax from blood entering the chest wall area and collapsing the lung. In either situation, the person will require medical intervention at the emergency room or a local physician. A punctured lung is never an enjoyable experience, but with rapid treatment, symptoms can be reduced and pain reduced. I'm Captain Joe Bruni. Stay safe, and we'll see you next time.